possible to introduce yourself?
So, I'm Kim Do, and I am head of the Center of Psychiatric Neuroscience. It is a research center in the psychiatric hospital belonging to Lausanne University Hospital. In this center, we have both clinics with patients and also research on the pathophysiology of mood disorders, of Alzheimer's, drug addiction, and also schizophrenia, psychosis. This is this unit that I am also directing. Yeah?
We would like to know, in your opinion or in your career, in your research, what would be the hot topic that you are working at or you think the science is working at right now?
In my field, that means in psychosis or schizophrenia, I think the hot topic right now is the challenge with early intervention and early diagnosis. We do know that we have some treatment with antipsychotics in schizophrenia, but we treat only one group of symptoms and like positive symptoms, but the other are not very well treated. And these antipsychotics has a lot of side effects. So the challenge now is how to go over that, so beyond the dopamine theory, that which is based on which antipsychotics are based. So our group, we think the hot topic is to go to early intervention, and for early intervention we need early diagnostic, and for that, because we know if we can early detect, we can there is a better prognostic after. There is less of relapse and more remission rate. Yeah? For early detection, what should we need? We need biomarkers. Yeah? We need really biomarkers, because now all the diagnostic is based on clinical symptoms, which are very heterogeneous, and it's very difficult and very not specific, right?
What are the biomarkers or the neurotransmitters or the tools that you are working at are promising right now?
So promising right now, thanks to our basic research, we have detected that there is a core pathophysiology which which is dealing with oxidative stress. Yeah? Because many processes involved in schizophrenia, such as neuroinflammation, NMDA receptor hypofunction, or even dopamine, at the end all converge to oxidative stress. So we have now biomarkers based either periphery or also on in vivo in patients, magnetic resonance, spectroscopy, also diffusion tension imaging, all these modern imaging techniques which can help us to have biological biomarkers.
What are the biomarkers that you think that are promising in your findings?
So one of these is linked to the antioxidant system, such as now in the brain we can measure glutathione, in the blood we can measure the glutathione enzyme activity, because we see that the enzyme activity, which is the glutathione peroxidase, is correlated with the brain glutathione. And also it can predict the genotype, the risk genotype to have low brain glutathione, and is also associated with low hippocampal volume. Yeah? And low hippocampal volume, hippocampus is very important for memory, learning, all the cognition. So this is what we think is very important. Yeah?
Is there something right now in this topic or in these biomarkers that are already being used in clinical practice?
No, sadly not yet. We are still in the tunnel. We see some light at the end of the tunnel, but we are still in the domain of research. But what we have now through our what we call translational research, which is bridging basic neuroscience with clinical research, we have now gone through a clinical trials with an antioxidant, which is N-acetylcysteine. Is quite promising. We have seen that in a double-blind, randomized, placebo-controlled clinical trials in chronic schizophrenia with NAC and acetylcysteine over 6 months. We see that NAC improve add-on, so supplementation of NAC improve negative symptoms, decrease the side effects, and also ameliorate the EEG, event-related electroencephalography, which is related also to some component of NMDA receptor hypofunction. So, and this is in chronic. It was done together with a group of in Australia, and we just finished now in collaboration with Philippe Conus, which is the chef of the Department of Psychiatry in Lausanne. We have just finished a clinical trial in first episode patients.
Wow.
And it is also very promising. We saw that in a group of patients in which the peripheral biomarker, the glutathione peroxidase, so that means the high oxidation status, in that group we can improve the positive symptoms. Yeah,
promising.
It's very promising, and in the whole group of patients who has taken NAC versus placebo, we see an improvement of cognition, which is very, very promising. It is the first time actually that antipsychotic cannot improve cognition, and namely the speed processing. Yeah.
How clear you think it's going to be the tunnel 10 years from now in this area? Your wish or your idea? Can be both.
Yes, I could say what we hope,
but you hope and what you think is going to happen. For real.
I hope that if with this early intervention and early diagnostic, and also thanks to the translational approach, real collaboration between basic researcher and clinician, and also training of the young MDs to do in that way, we think that we can really go to prevention of psychiatric disease. So that means we have to go earlier to adolescents, to children, to know the mechanism and to prevent, because we know that there are genetic risks and also environmental risks. So like traumatism, childhood traumatism is a big risk. So that we can prevent also, or immediately after traumatism, trauma intervene there. Yeah?
Yes.
We have seen that, for example, in additional insults, so in models now with genetic risk, when we intervene just after, like antioxidant and environmental enrichment, I would say psychotherapy, so we can really rescue all the morphological and functional anomalies in the models of schizophrenia. Neuroprotection, neurogenesis, so to act on epigenetic mechanism. Yeah?
Wonderful.
Yeah. This is what I hope. But maybe what can happen, I don't know.
Okay.
But, yeah. I think in the future, I hope so, there would be more kind of initiative in which industry, together with private partner, private partner, foundations like that, and university, and also patients associations, and also I would say the regulation like FDI or Swiss Medic in my country or in Brazil, I don't know, they will work all together in order to drive the field and collaborate together, and also through different countries also, because psychiatric disease, you know, it's a really in the future we see that now in 5 or 10 years, because of the chronic disease, it is on the top of the list. It's not cardiovascular, it's not cancer because it's the mortality, but like depression, schizophrenia, it is the top list. And what is also very important, it affects our young people. It's between 18 until 35, 40, and this is the whole active component of our society, right? It's not Alzheimer's, so Alzheimer's is more, or cancer is more at a later age, right? And this is our future. The youth is our future.
Yes.
So this
schizophrenia get more prevalent in your opinion in the last 10 years, 20 years, or is stay steady as 1%, 0.9% of the population?
It has been reported that could be increased, but I don't think so, because we detect better tool, more psychiatrist professional going out. Otherwise, it was a lot of stigma in schizophrenia, so people hide it a lot, and there is a lot of suffering among not only patients but also families, friends. This is what we really think that we have also to do for society to destigmatize the psychiatric disease, and schizophrenia is one of the worst in
it's like people. The cancer of psychiatry.
Yes, but the cancer you are not ashamed of. Why schizophrenia people hide it, and I think one way of destigmatization is knowledge, is information, is scientific information. To say them it is a disease like other disease, like cardiovascular, like other somatic disease. Nothing to be ashamed of. It's a brain disease. It's more complex because we don't understand the brain so much, and also it's linked a lot because it's linked to the mental, yeah? Yes. So it's linked to the society, linked to the human, so humanities.
Better doing
you know better than me on that, but this is what I think it is a lot of ways here to do, and that we learn a lot from our patients too, a lot, yeah.
Thank you very much. I hope to see you in 10 years.
Okay.
Talk with you again about that.
Thank you very much. It was a real pleasure and big honor. I really enjoyed the congress. I find very successful, and I learned a lot too.
Okay, thank you.
Thank you.